Voyage.
She won't stop crying. I don't know what to do.
Her breathing is normal. Her heart rate is a little elevated, but that's likely due to the crying. How long has she had this rash? And the blisters?
They keep recurring every few weeks.
We need to get your daughter to the pediatric ICU.
No, you don't understand. I've been here before. This keeps happening. I bring her into the hospital, I take her to pediatrics, and the doctors can't find anything wrong with her. Then she calms down after they treat the blisters. So then I take her home, and sure enough, 3 weeks later, the rashes and marks appear again, and she's in pain and crying, and the whole cycle keeps repeating again and again and again, and I can't sleep.
Okay, I understand, Mrs.
It's Miss Miller. Nancy Miller.
All right, Ms. Miller. I'm going to send you to the pediatrics
But
wing.
her breathing! She needs oxygen! Her face was turning blue! Don't send me to pediatrics! They won't help me!
You did the right thing coming to the ER. Her breathing is okay now. These blisters don't look good. I'm going to check in with pediatrics where your daughter's medical history is concerned, and then I'm going to bring in some other specialists to consult on this.
That'll take too long! She needs help now!
She'll get help now, Ms. Miller. I promise. Take her to pediatrics. I'll meet you there.
Dr. Isaac, dial 0.
And you don't think it's too short?
No, I think it looks great. Different.
I just needed a change from the long hair, you know? It became impossible to maintain. I was on the fence when my stylist wanted to cut it Selena Gomez because the dudes on the app seemed to like Megan Fox long hair, but whatever.
Well, I like it. I think it's It's nice.
Thank you. Anyway, so about this patient. She's brought her daughter in how many times?
5. Baby Zoe's only 18 months. The mother keeps bringing her in because of unexplained weight loss and recurrent blisters and a rash. She usually goes straight to the pediatric unit, but this time she came to the ER.
Why?
She thought Zoe was having trouble breathing. We checked her out. Her breathing was normal. But that rash looked nasty. Poor thing couldn't stop crying. Anyway, I talked to the doctors in the pediatric unit, and honestly, they're stumped. The baby always seems to get better once she's in the hospital. They treat the blisters, the rashes clear up. Then 3 weeks later, Nancy and Zoe are back.
Maybe it's an allergy or something in the house. Mold?
Nancy insists she checked out her entire house, and there's nothing she can find that would cause Zoe's condition. Plus, she's been at her sister's house for the past 2 months, and Zoe's still ill. So...
It might be something psychological. But Zoe's only 1.5. Even as a child psychiatrist, I've never had a charge that young.
I know, but we have to look at all angles.
Okay, give me her story and lab results. I'll see what I can do. Hello, Mrs. Miller. My name is Dr. Jones, and this sleeping angel must be Zoe.
Shh. I finally got her to sleep. She's exhausted. I'm exhausted.
I'm sorry. This must be so hard.
I just want to know how we can fix her. Every time I come in here, they treat her symptoms. But what's the cause? How can we stop whatever's happening to her?
We're working on it. I see Zoe has been tested for immune deficiencies, intestinal disorders, and sepsis. The doctors have given her broad-spectrum antibiotics intravenously in the hospital for her rash and blisters, correct?
But they keep coming back. It's an immune disorder, I'm telling you. The doctors here keep saying they can't find anything. You all are missing something. I just know it.
Ms. Miller, is there anything at home that could cause this? For example, sometimes even a fabric softener can cause allergies in very small children.
Stop it! Stop. I've already told the doctors here that there's nothing in my home causing this. I'm tired of answering the same questions again and again.
I'm sorry, Ms. Miller, but it's procedure. In order to help Zoe, we need to rule things out, ask questions about her well-being. Sometimes things change between the first time you brought her in and now, so we have to keep checking for the benefit of your daughter.
All right, fine. But as I've said many times, I don't know why she has blisters. If I knew, I wouldn't be here.
What about Zoe's eating habits? What do you feed her?
Baby food?
She's 18 months old. Don't you feed her regular food? Fruits and vegetables? Dairy? Protein?
Oh, I mean, yes, sorry. She's growing up so fast it's hard to keep track.
Looking at Zoe's chart, it says she gains weight in the hospital but loses weight at home. Can you explain that?
No. I mean, The hospital must be filling her up or something.
This is a healthy weight gain, Miss Miller. Her weight loss at home isn't good for her.
Well, I don't know. I feed her.
We're going to have to keep Zoe in here for observation. We'll treat her symptoms, of course. But as a psychiatrist, I'd also like to monitor her mental state while she's here.
What mental state? She's a baby.
She's still a human being. A tiny one. But one that lives in the world and is growing and learning from the people she meets and the experiences she has.
Fine, whatever. We can stay overnight. I packed a bag already.
No, Miss Miller. I'm going to need to monitor Zoe for at least a week.
What, a week? I can't take that much time off from work.
We need to know what's happening to Zoe.
I'm not leaving my 18-month-old child unattended, even if there's a pediatric nurse on call. I will be with her every waking moment. And I won't let you keep us here for a whole week. You need my permission, and you don't have it.
Okay, that's up to you. But if you want us to help her...
I will give you 2 days. Figure it out. Oh no, poor baby. It'll be all right. Come here.
Young is gonna have a field day with this one.
Hope this is good news, Hardy.
It is. I brought on a professor of psychiatry at Harvard Medical to be an expert witness in our case, Dr. Noah Swetnam. He's an expert on mood disorders. He's going to be pivotal for this case. This guy is a rock star. He's the John Bon Jovi of the psychiatrist field.
I know Dr. Swetnam, but here's a question. Why Swetnam specifically? Lots of rock star psychiatrists are experts on mood disorders, including depression.
Because last month, the Journal of Psychiatry published a study led by Dr. Swetnam where the physical causes of depression, including, wait for it, pancreatic cancer, were examined. Check this out. The whole study is in there.
Ooh, there's an article in here about the correlation between depression and meningitis. Reminds me of this one case back in med school where
Young, focus.
Right, sorry. Oh, here's Dr. Swetnam's study. All right, I see what you're saying.
He states quite clearly that although depression can be an initial manifestation of pancreatic cancer, it is uncommon. So psychiatrists do not usually order CT scans of the abdomen in all patients with depression.
Instead, they only consider doing so when there are other indications of cancer, like jaundice, abdominal pain, and weight loss in excess of what's usually seen with depression. And Joe had none of the other symptoms.
Dr. Swetnam believes you did nothing wrong and followed the standards of care needed. He is ready to sign an affidavit stating you did an exemplary job of evaluating Mr. Joe Price.
And Swetnam's well known in the field, so this helps us too, right?
It's a big get for our case.
Thank you for coming in, Miss Hickson.
It's Doctor.
I'm sorry?
I'm a doctor too, so it's Dr. Hickson.
You're a psychiatrist, correct?
Yeah. And that still makes me a doctor, Dr. Lutz.
Right. Anyway, your test results came back. You're not pregnant.
Oh, thank God.
However, we found blood in your urine, and your FSH levels are low. I want to do a prolactin test as well to rule out some things, but something isn't right, that's for sure. I'd like to get a transvaginal ultrasound too.
Wait, why is there a need for that?
Because there's a possibility of uterine fibroids or ovarian cancer. Could be anything. We need to make sure that's not the case.
Cancer?
I didn't say it is cancer, but it could be. So let's make sure. You have to take a few days off from work, and when all the tests are ordered immediately.
I can manage that.
I will probably have to handle the transvaginal ultrasound myself since our gynac is on leave. The blood tests you can give now.
All right.
Danielle at the front desk will help you out with paperwork and appointment times to get your additional blood tests sorted out. You can go to her now and shut the door behind you.
Wow. Asshole.
Dr. Purcell, GP is on line 4. Whoever is paging Dr. Purcell, GP
So
is on
now
line
that you
4.
have Dr. Swetnam on board, is it likely that Joe will drop the case?
No, but it'll weaken it enough to discourage his lawyer. And if we can find more experts to come forward, it'll weaken it to the point of droppage. At least that's Mr. Hardy's strategy right now, since I don't want to settle. Whoops. Clumsy me.
Dr. Young, you're right. You just seem off lately, and I've never seen you drink so much coffee in your life.
Nothing I can't handle.
You tried melatonin for the insomnia?
Who said I have insomnia?
The bags under your eyes?
Doesn't really work for me. I need something stronger, but the stronger stuff has side effects.
So, if you were a patient, what would you tell yourself if you came to you and said what you just said?
What?
You know what I mean.
I'd recommend cognitive behavior therapy and sleep hygiene. You know, only use the bedroom for sleep and sex, not for watching TV. I would also recommend turning the clock around so it cannot be seen during the night, and to avoid caffeine and exercise before bed. And if none of this worked, then I would prescribe medications for insomnia. Thing is, I am sleeping, just not enough.
Really?
Yes. I wouldn't be standing if I wasn't, Jones. And I wouldn't notice your new haircut and tell you how much it suits you.
Thank you. I still think you should go see someone, Young.
Fine. I'll make an appointment. I promise. Now, what were you telling me about your patient?
Right. 18-month-old named Zoe. Her mother Nancy brings her in with an array of symptoms. A rash and hives, mostly. Poor baby is in pain, and her mother doesn't know why. Except
you think she does know why.
I'm not sure. What I'm sure, though, it's Nancy knows something she isn't telling us. I get a lying vibe from her.
Munchausen by proxy?
Yeah, maybe. But with that disorder, it's a pretense. Someone pretends another person has an illness they don't. Baby Zoe has actual symptoms. It's not just in Nancy's head. Then again, she could be doing something to cause Zoe's symptoms.
And Nancy insists nothing at home is affecting Zoe.
She gets downright rude if you even suggest it.
Sounds precarious. Like you have to tread lightly with the mother while still trying to help the child.
Which is exactly why I've come to you. She's giving me 2 days to figure out what's wrong with Zoe. In my opinion, I can't figure that out in the hospital. Not with Nancy hanging around like a hawk, preventing any doctor from being alone with Zoe.
I don't think this is a case you can solve in a hospital at all. Send Zoe home.
Dr. Young?
Send her home. And then tomorrow, you and I are going to do something most doctors don't do anymore. Make a house call.
All right, Miss Hickson. Dr. Hickson, lie back. This should be over soon. There will be some discomfort, but it won't hurt.
It does hurt a little.
You have a retroverted uterus? That's okay. Lots of women have that.
It's still not supposed to hurt.
Lie still?
What is it?
I'm not sure yet, but there's something. Could be nothing, but there's something.
That's reassuring.
Hello, Ms. Miller.
I told you, there's no reason for you to make a house call. I would have brought Zoe back in if needed.
Dr. Young specializes in cognitive behavioral therapy, and his unique method involves treating patients in the environment they're most comfortable in. For Zoe, we assumed that means her home.
Well, yeah, but I've already told you there's nothing here that's causing her symptoms.
May we come in anyway? I'd like to speak with you about Zoe, and maybe meet the little one too.
You wanted us to provide the best possible care for your daughter, Ms. Miller. This is the best possible care.
All right, fine. Come in. Would you like anything to drink? I've only got water and coffee.
I'll take water if that's okay. Thank you.
When did you return home, Ms. Miller?
From the hospital? This morning, of course.
No, from your sister's house. Isn't that where you said you were staying temporarily?
Yes. I decided to bring Zoe here after the hospital stay. I'll go and pick my stuff up for my sisters later.
Are you anxious, Ms. Miller?
Always. How can you tell?
You're pacing up and down. You can sit down with us, you know.
Okay,
I must say, you keep a spotless home.
thank you. That's why I'm sure it's nothing in my home that's affecting Zoe. I use natural cleaning products as well.
I can see that. Smells nice and lemony in here. And it's just you and Zoe?
My husband died when she was 3 months old.
I'm sorry for your loss.
Zoe's all I've got. That's why I can't stand what's happening to her. I'm worried sick all the time. Can't sleep, can't eat. I just want her to be okay. The antibiotic ointment is working on her rash, so she's finally not in pain and is asleep. But it'll come back. It always does.
Could I look in on her for a moment? I promise I won't wake her.
No. She's a light sleeper. If we so much as open the door, she'll wake up and she's been so tired with all of the pain, I need her to sleep.
That's all right. Let me ask you a few questions.
I've already told the hospital and the doctors in the pediatric ward everything. Why do you people keep asking me questions I've already answered?
I haven't even asked my question yet. I guarantee you haven't been asked this.
All right, what is it?
Is there a specific brand of cleaning product you prefer to use?
No. Just whatever's on sale and is not full of chemicals.
How long have you lived in this apartment complex?
Since before Zoe was born.
All right. Last question. When you bring Zoe into the hospital, is there anything you bring with her from home? Like a blanket or a toy or anything?
Yes, her blanket. She can't go anywhere without it.
And is the blanket ever taken away from her in the hospital?
I make sure she always has it. Nurses have tried to take it away, but she screams bloody murder without it, so I make sure she has it.
All right.
It's not the blanket, though, that's causing her issues. I wash it all the time when she's asleep and won't notice. And I switch between different brands of detergent and fabric softener, so I know she isn't allergic to that stuff.
I can see you've been thorough. Very good.
Thank you. I'm doing everything I can for my daughter, and every time I bring her into the hospital, there's always this implication that I'm neglecting her or something. But you can see for yourself, I'm not.
I have a proposition for you, Ms. Miller. I know we sent you home with Zoe yesterday, but I believe it might be beneficial to bring her back to be monitored for a week.
No, I already told Dr. Jones earlier. I can't take a week off work, and I'm not leaving her there for a week.
She'd be fully monitored. We'd install cameras in the room that you can monitor as well.
Absolutely not. It just seems like the hospital is going out of its way to scrutinize me and my daughter.
Not at all. The hospital routinely uses cameras to monitor patients with hard-to-diagnose illnesses. A common example is children with seizures when there's a question of what type of seizures they're having. Being able to see this on camera firsthand is extremely helpful.
If it will help your child, why wouldn't you want us to go the extra mile?
I have to think about it, but as of now, it's a no.
But
You should go now. I'll call you if I need to bring Zoe in again.
All right, Ms. Miller. Think about what we said, though. All we want to do is help you and Zoe.
so, what do you think?
The smell in her house? It wasn't organic lemon-scented cleaner. It was phenol, full of chemicals.
You think Zoe is reacting to the phenol?
Not at all. I just think Ms. Miller's a liar.
She's definitely hiding something. But now what?
Well, I have another idea. Inevitably, Nancy's going to bring Zoe back into the hospital, and when she does, we'll find some way to distract Nancy so that we can get Zoe's blanket away from her.
You think the blanket is making baby Zoe ill?
It's one theory. You saw how weird Nancy gets when she mentioned it. If I could examine it, maybe get a lab to do a tox report on it,
Is that a bad plan B, considering she said no to the cameras?
we'll just have to wait till she comes back to the hospital.
What am I looking at, Dr. Lutz?
What you have, it's called premature ovarian insufficiency. You also have polycystic ovarian syndrome. See this little diamond here? That's a cyst.
I see. And premature ovarian insufficiency?
It's a bit like early menopause, but slightly different.
That tells me nothing.
Essentially, your ovaries don't supply eggs anymore. And the PCOS on top of that means your fertility is almost completely diminished.
Wow.
Yes, well, also your insurance didn't cover some of the tests we did, so we'll be billing you for those. See Danielle at the counter for how much you owe.
You've just told me I have an incurable fertility disease, and without even giving me time to process it, you're talking about money?
Well,
Where did you go to medical school? Because they didn't teach you anything about empathy and having a bedside manner, did they?
I don't think.
I'm getting a second opinion, and I won't be coming back to this clinic.
But
Good day, Dr. Lutz.
Oh, hi, Aaron. I mean, Dr. Angerson?
Hey, remember our old cheerful pal Nancy Miller? She's back. She's saying the ointment we gave Zoe isn't working and that her rash is getting worse.
Excellent. I mean, not for baby Zoe, but for us. Okay, I'm gonna grab Dr. Young and come to the pediatric ICU. You good with distracting her?
I'm not a very good liar. I failed improv in college. I was supposed to quack like a duck, and I barked like a dog. Got a big laugh, though. I get a little nervous when I'm on the spot.
You'll do fine. Just ask to speak to Nancy privately and tell her you're concerned Zoe's going to need to be transferred to a special facility in Utah or something. That'll keep her busy. Dr. Young, you in?
I'm here.
Nancy Miller's back. It's showtime.
Whatever you need to talk to me about, Dr. Angerson, you can say it to me here.
This is about Zoe's future. You need to come with me.
We'll stay here with Zoe and make sure she gets her meds.
No, don't go near her. She's very sensitive. Just wait with her while I step outside.
All right, Ms. Miller.
Now, go for the blanket.
There, baby Zoe. It's okay. We're just gonna take...
What are you doing? I told you not to go.
Ms. Miller, stay back, please.
You don't understand.
There's poison oak inside the blanket.
It's not poison oak. It's medicine.
That's definitely poison oak. Ms. Miller, have you been making Zoe ill on purpose?
No, you don't understand. She needs me. She needs me.
Wow. What a horrible case you've been dealing with. I know Munchausen by proxy usually involves mothers faking their child's illness, but this is a level I've never seen before.
You hear about these things in medical school. Like the famous case of a mother who injected her own son with...
I don't even want to know. Oh, this is all so horrible.
I know. Poor Zoe.
What's going to happen to her?
They'll hold her in the maternity ward until a relative takes her.
And if no relative takes her?
She'll go into the system, sadly.
It's weird, isn't it? Who gets to have babies and who doesn't?
Hey, you okay?
Not really.
It's okay. I'll get it later. Talk to me.
No. It could be important. Just get it. I'll fill you in on my day later.
This is Dr. Young.
It's Hardy here. Listen, I've got some bad news. Dr. Swetnam, our rockstar expert witness, yeah, he just dropped out of the case.
The Mind Doctor is a production of Voyage Media. The series is produced by Nat Mundell, Robert Midas, Dan Benamore, and Alyssa Goodman. Executive produced by Dr. Peter Hartman. Inspired by the life of Dr. Peter Hartman. Directed by Alyssa Goodman. Written by Minodi Vaishnav. Starring David Pinion as Dr. Young, Meg Hensley as Dr. Hickson, and Sixta Morel as Dr. Jones. Additional cast credits available in the show notes. Edited, sound designed, and mixed by James Scully. Original music by Derlis Gonzalez. If you're enjoying the show, please leave us a 5-star review on Apple Podcasts, Spotify, or anywhere you're listening, and subscribe now for future episodes.